it seems like all these injections stopped working, and
Yeah.
we didn't know why.
And I think that's the biggest problem with taking care of pain in the region that you have pain is, and given your medical history, is that there's a number of causes that can potentially lead to that. I think probably the most confusing thing initially when we started out is that, you know, the imaging of your spine is fairly normal. You would expect to see that with you. But the fact that you have multiple sclerosis doesn't rule out the potential for a nerve lesion or even spinal cord lesion leading to pain in that region. So I can understand why maybe your neurologist thought that it could be MS-related pain. And I can also understand how somebody may empirically do an injection that carries very low risk to try to diagnose it that way. When I initially saw you, I relied more on the physical exam, considering your lumbar MRI wasn't overtly screaming radicular process or nerve root problem, in which case I relied on my exam, and it did suggest that you did have an SI joint problem. And so we went ahead and injected it and got a nice result initially. And even those temporary results can be treated further, like we did with the radio frequency. But the SI joint is very interesting in that it doesn't always cause a tremendous amount of pain in certain people, but in other people it will. We see in some patients that have had prior spine surgery, some patients that have abnormal limb architecture, one that's longer than others, maybe have an abnormal gait, that SI joint would become very, very irritated. In you, I think I attributed it more towards your abnormal gait due to your multiple sclerosis, not necessarily thinking that it was the hip joint that could have been the problem. But nonetheless, we treated it, and you seem to get better. But keeping in mind that the SI joint is just an extension of the pelvis, and right around the front side there is your acetabulum, where your hip actually connects to your pelvis. Everything kind of came into play and made more sense over time. The one thing we did do was we did inject your piriformis muscle as well, because you started to have those radicular symptoms of pain down the leg, which again, backing up, made more sense to somebody who might think you had a spine problem, but your imaging was normal. So the piriformis muscle in turn also attaches to your hip. So everything started to center around the hip joint itself. And so over time, things became much more clear. And I think Dr. No helped us out on that front once you actually were able to see him.
Yeah. Once he gave me that Novocaine injection in the joint, and
Then it became pretty clear.
yeah.
But I think overall, we've gradually been working towards finding a solution, and all these other potential causes that can mimic pain in those areas were addressed. So
And we figured it out,
we figured it out.
like you said you would.
Oh, I don't know if I said I would. I
You
said I'd
did.
try.
You told me, and this is, I never forget. You said, "Brooke, we're not gonna stop trying things until we figure this out." And I didn't cry in the exam room, but I definitely cried on the way home because I was so happy.
Okay.
And we did figure it out, and I'm just really grateful.
Good.
So much.
Very happy you did so well.
Thank you.
All right. Anything else you need today?